Okay, brilliant. Yep. So if everyone can take a seat. So if you go to those that still aren't sitting down, if you click on the View Presentation Zoom in, that will put you into a seat. So I was just it's really great to see you all here. I'm so glad so many of you turned out, and there's quite a lot of new people here, which is really good. But I'm just going to spend a couple of minutes just explaining why we're here and how we've been using Cube to drive change and innovation in healthcare. I work in National Services Scotland. My job is Head of Innovation. And when I started doing this job a couple of years ago, before I started really getting into it, I wanted to find out why we found it so difficult. What is it that stops us being innovative as an organisation and as a health service provider? And common things kept coming up. So it's hard to get people together. It's really difficult when people are busy to get people into a room together to do any thinking around innovation. Despite all of us saying we need to take risks, we really don't like taking risks. It's not comfortable for us in the health service, I don't think. We do lots of learning. We go away and do lots of learning. We're really encouraged to do that, but it's really difficult to apply that in the workforce in a way that's sustainable to make change happen. We have a very kind of strong culture in the health service, and it's really hard to change how we work and think about different ways of working. And finally, we're just really busy. Everybody's busy all the time, so it's really hard to stop and think about innovation. And I'd met Eddie at a leadership program and kind of seen Cube and what that could do, so I thought, let's give it a go. What could Cube bring to us as a way of working that would really drive that agenda forward? And I quickly discovered that it really helped collaborative work, and it really helped bringing people together easily and quickly to start working on things together. We started to develop really good innovative ideas, really good spaces, good tools and models on Cube to help us do that. We were learning and applying immediately, so everything we learned we were able to apply to our work and demonstrate that to deliver the work quickly, and we were able to share that learning directly with our teams as well. This all led to us starting to change how we behaved. We were starting to work in a really different way, a really positive way. In terms of behaviours, and it fitted in with our day job. It didn't feel like an extra add-on, so it was hitting all of those things that we needed it to hit. Here's some of the projects that we've been running on Cube, and some of the sponsors of these projects are here today, so if you get a chance and you want to ask some questions, please do at the end of the session. As I said, we started in NSS, National Services, with an innovation framework, and Fiona's here today. She led that project. That only took us 8 weeks to do that for the entire organisation by working on Cube. We've got some innovation projects. We're doing a piece of work with a private company around Fitbits and collecting data from patients who go to the gym as a gym membership, and see if we can align that with national data sets to see if there's anything in there that would help with either the patient self-management of health or decision making. We have the National UTI Network, which has been run by Health Protection Scotland, and we're getting all of the stakeholders onto Cube to run workshops, so that's working really well and really effective. We have a project for improving blood transfusion practice called Right First Time, so that will work across all the health boards and blood banks in Scotland. We have No Delays. Jamie and Aileen are here. This is a Grampian innovation that we're now looking to roll out across other health boards in Scotland. So again, getting people together much easier on Cube to speed up that rollout. And finally, we've got Kerry and others here from Regional Planning in the North. Their core teamwork on Cube to work out what their strategies and plans are, and then they bring in core stakeholders to work on their key projects. So that's just a few of the projects, and most of those people are here today if you want to chat with them. So that's brought us to today, CubeX. This is the first in hopefully a series of events. We thought it'd be really good to try something very different to bring people together. Pentacle, the Virtual Business School, are sponsoring it, and it's been partnered by Digital Health Institute, Scottish Enterprise and the Innovation Leads, and they've got stands up in the back left-hand corner which you can visit later and see what they're up to and speak to them. We're hoping to develop an innovation incubator to really help drive innovation forward in healthcare. As part of that, we would run CubeX series, innovation masterclasses. We'd do some of the open innovation that NHS leads are involved in with Scottish Enterprise. So there's a lot that we're hoping to do in this. There's lots of projects that are looking to work on Cube right across Scotland, and again, it really helps people collaborate and deliver those projects at speed. So that's the kind of next step. So as I say, today is the launch of CubeX. We had a theme or an idea around big data because big data is everywhere and everybody's talking about big data, but we wanted to do it with a bit of difference because there is so much data, we don't really know what to do with it. So we really wanted to start with the patient or the person at the centre of that use of big data. So we've got Professor Jason Leach, who's going to come up and give us a presentation in a minute. And then that's going to be followed by Professor Eddie Obeng, who's going to talk about data everywhere and not a drop of information. So how do we ask the right questions of big data? So on that note, I'm going to finish and invite Jason to join me at the lectern, and we'll kick off with our first presenter.